Good morning. My name's James Stanger, and this is another video in what I think will be a very productive series on sperm-oviduct interactions and sperm fertilizing capacity. This is a very short video, and I'm just going to paraphrase some key elements from this paper. It's a 2022 paper in Andrology by Saber and Kohler, which is extremely well written, and I think a really great reference point to start reading about this concept that I'm talking about, of sperm interaction. Um, but there's a lot more stuff coming out later on. I've already done one video, which is probably far too long. I was flagging towards the end, but this gives you an idea where I intend to go with these series of videos. But let's just concentrate on this one to start with. All my adult IVF experience, which is close to almost 50 years now, has been based on the premise: you take sperm, you put it into a dish, add an egg, and they fertilize, and everything's you just don't have to worry about it. All the sperm are normal. But reading these articles, which have largely come out in the last couple of years, or this one was 2022, has been opening my eyes to something which I think has always puzzled me. What happens after intercourse or insemination when the sperm swim up the duct? How does the sperm, where does the sperm go, and what does it do? And I think that I have been blind to these publications, and I feel real guilty over it. But there is quite a lot of literature now growing, suggesting that in fact the sperm just don't swim up the tube and out the other end of fallopian tube and disappear. In reality, the management of sperm after insemination or intercourse is a highly managed and structured affair intending to keep the sperm in an arrested but ready state, only to be activated after the ovulation and the surge of follicular fluid down the fallopian tube. And that is totally different to what happens in vitro. And I'm starting to see now that the in vitro environment is absolutely the most crazy, sterile environment, and no wonder it hardly ever works. 50 years of experience has come to this point. It's pathetic. So let me just go and quickly go through this paper. I only want it to be a short video, and I'm paraphrasing. All the text is coming from this video. It's open access, and I believe but the point is I want you to, from this video, go back and read the paper, which I think is important. Okay, so let's start. So I'm being a bit evangelical, aren't I? But I have gone through a bit of a road to Damascus change in my thinking, and since doing these YouTube videos, and I think these videos are meant to let you know where I'm thinking. Okay, introduction. Sperm-oviduct interactions play a pivotal role for successful fertilization. Only sperm, which are capable to interact with tubal epithelium, will survive and maintain fertilizing capacity for 4 to 5 days. And this is in humans, but in most mammals, weeks in birds, and even months in bats. In other words, it's only the sperm that bind to the tubal epithelium that are important, and all the other sperm are lost, phagocytosed, or washed out. So it's only the sperm that are capable of binding to the tubal epithelium that are the sperm that we should be interested in. And critically, they're held there until when the cumulus oocyte complex has reached the oviduct, together with all the residual flow, with a follicular fluid rich in progesterone and other compounds. Will successful fertilization only occur when the spermatozoa and the oocyte meet in the right place, the tubular ampulla, and at the right time within 12, 24 hours after ovulation. So the sperm are kept in a rested state until they are activated by progesterone or other factors, and then they have only 12 hours or so, maybe not even, I don't think it's even 24, in order for the sperm to swim up the tube, interact with the cumulus complex, and fertilize the egg. You can see why often it doesn't work, particularly if intercourse has been a couple of days before, but that's a whole area of science which I have no information on. Thus, the timely transport of spermatozoa in the female genital tract and the maintenance of fertilizing capacity in the oviduct are essential to maximize the chance of fertilization, and at the same time to ensure that only the very best spermatozoa or spermatozoon will be successful. Now, the limitations to date: most of the studies investigating sperm movement and sperm oviduct interaction have been performed under in vitro conditions or posthumously. However, in these studies, the 3D microarchitecture of the tubal mucosa is lacking, thus making it impossible to analyze the behavioral pattern and swimming responses of the sperm within the oviduct. In relation to molecular interactions, tubal cell cultures and oviductal explants have provided invaluable insights into the changes in gene expression and protein secretion after sperm binding, and I have a sense that going forward, the next 5 or so years, we'll see a lot more work focusing on these particular chemical or molecular interactions between sperm and epithelium. However, under in vitro conditions, the complex interaction between epithelium, the underlying connective tissue, and smooth muscle layers are lacking. And there's another video I'll be doing probably in 1 or 2 weeks showing that this binding initiates an immunological response in the oviduct, telling the female that there is sperm ready. Section 2, sperm transport and sperm behavior on the way to the oviduct and within the oviduct. Hino and Yamaguchi found in the mouse, at least, that there are active contractions in the oviduct in direction of the ovaries, which result in rapid transport of luminal fluid. The oviducts secrete fluid continuously. Thus, the oviduct's peristaltic movements and the active upward flow of oviductal fluid in combination with sperm motility enable the sperm ascent, the complete acquisition of fertilizing capacity and the occurrence of excessive fertilization in the oviduct. Importantly, these observations make it clear that chemotaxis, rheotaxis, and thermotaxis of spermatozoa are likely to be the decisive mechanisms for sperm migration towards the cumulus complex after ovulation. That's interesting, but I'm not quite so sure whether, in fact, 4 or 5 years later, that's now true. There's now quite a lot of data showing that, in fact, they are really important and they have different roles at different parts in the migration. And I can refer you briefly to my previous video, and there'll be new ones coming up soon on this topic. Now, here's the thing that's interesting, this concept of the sperm reservoir. When sperm enter the fallopian tube, spermatozoa bind with their heads to the cilia of the tubal epithelium and form a sperm reservoir. The presence of a sperm reservoir has been documented in mice, rats, hamster, pigs, sheep, cows, horses. In humans, it is anticipated there is a sperm reservoir, as intercourse several days before ovulation may result in pregnancy. And remember that as soon as there's a rise in progesterone, cervical mucus becomes very impenetrable sperm. But really, the only sperm that can get in and form this reservoir of the sperm that have resulted from intercourse often 2 or 3 days before ovulation. So the concept of a reservoir is in fact almost implied to be true in humans. However, documentation of the formation of a sperm reservoir under in vivo conditions is still lacking. The binding to the oviductal epithelial cells enables sperm to maintain their motility and fertilizing capacity for 3 to 5 days in most mammals, weeks in birds. I'm repeating myself here. Most sperm bind to the ciliated cells at the isthmus, that is the beginning of the fallopian tube, the uterotubal junction, and this is the first site that they encounter. However, several sperm also travel further and are found in the ampulla. Interestingly, most of these sperm bound in the ampulla are located near the oocyte complex after ovulation, pointing to an important role of the ampulla for sustaining sperm with high fertilizing capacity. Now, this point she's making, I haven't come across this in subsequent publications. So I think this is something I need to follow up. But what caught my eye was this, as I mentioned before, that the ability to bind the reservoir is to keep the sperm functionally competent for 3 to 5 days. And if you, as I said before, as soon as ovulation occurs and the progesterone starts to rise, which is in the days preceding ovulation, cervical mucus ceases to be able to be penetrated by sperm. So by definition, the sperm in the reservoir has to be 2 to 3 or 4 days old. The sperm reservoir. Importantly, sperm motility is preserved in the sperm reservoir and is sustained by the molecular interactions with the oviduct and secretions such as glycoproteins and acidic mucopolysaccharides, which are produced by the secretory cells of the tubal epithelium. Now, this concept is almost unknown in IVF. Within the sperm reservoir, hyperactivation might also enable sperm to detach and bind to another site of the oviduct. And this concept of hyperactivation, which we see in sperm swimming around, they swim for a while straight, then they have a hyper whiplash activity, then they swim straight again. We all see this as a sign of capacitation. But I'm now looking at that and thinking in a different way, that this is a process whereby the sperm, it's a detachment, it's actually launching of the satellites, launching of the sperm. And hyperactivation is a process required for the sperm to detach from the epithelium. The key factors include the presence of an intact plasma membrane on the sperm head to enable sperm binding and formation of the sperm reservoir, the establishment of an active communication between sperm and oviductal cells, and C, the maintenance of sperm motility by nutrients provided by the tubal cells and the secretions of the genital tract. Now if that's also gone well past me in IVF, there may well be a lot of people working on this, but this is also fairly new to me. Never too old to learn, I guess. Consequently, as soon as the sperm bind to the cilia of the tubal cells, signaling cascades are initiated which prompt the synthesis and secretion of molecules. That is, it's a two-way street. Sperm selection in the oviduct. The oviduct is an important organ for sperm selection. Only sperm which bind to the tubal epithelium will be able to maintain motility and fertilizing capacity. The ability to bind varies considerably from individual to individual, but is also very different in one individual over time. Alterations of sperm morphology are correlated with reduced sperm binding capacity. Boom, boom. So all the people that have been bagging sperm motility, and I actually think that the WHO system is actually kind of wrong. People have been bagging sperm motility. Here, you suddenly see in one sentence the role of sperm morphology in being able to bind to the epithelium, which in ways is a highly selective process for fertilization. This last selection process in the oviduct might be the most sensitive in the whole female genital tract, has not only morphologically the integrity of the plasma membrane and sperm head and mechanical properties such as sperm motility, pattern of movement, but also specific molecular features of the sperm head are required for successful sperm binding and survival. It may well be that the Felix system, which has used a electrical separation of sperm, might actually be plugging into this molecular features of the sperm head. Oh, that's for another video. The release of sperm in the presence of the oocyte. The release of sperm from the sperm reservoir is triggered as soon as the cumulus oocyte complex arrives in the ampulla. But I actually think it's probably more that the flush of follicular fluid rich in progesterone and other factors, which are probably important. And then get this. The release of sperm is driven by hyperactivation, which is like launching of the satellite, which is characterized by high amplitude asymmetrical beating of the tail, as well as membrane change of the sperm head, which reduces binding affinity to the tubal epithelium. Hyperactivation is induced by an increased influx of calcium through the cation channels of sperm, cat sperm. Now that's as far as that article got. That's 2022. And I have to say that the thinking the last couple of years has changed quite a bit. But I'm going to jump right to the very end. This was published a little while ago from Chinese authors. They're always playing with these things. They're always doing something different. And I'm only just want to point this that here is the Chinese have created some form of microfluidic chamber for selecting sperm based out on the total concept of sperm migration and binding. And I have to do a whole video on that probably in a couple of weeks. But just to let you know, all that preamble published in 2022, you can now see manifesting in some form of microfluidic chamber, right? I don't know whether this works or not, but that's where they say we design and fabricate a female reproductive tract on a chip that mimics the entire physiological microenvironment in vivo sperm selection with clinical validation performed using samples from patients. So there we are. This selects sperm with ultra low fragmentation index. And by the way, if you look at my other video, one of the key things for this is these sperm that bind have normal DNA. So eggs almost never, ever see sperm with elevated DNA fragmentation. So all the work we've done in the last couple of years looking at elevated sperm, should it work? Should be tested? Should be tested? Should be not? Just make no. In reality, it's a total artifact because in vivo, the oocyte theoretically almost never, ever sees sperm with damaged DNA because they just don't bind to the tubal epithelium. Okay, so my comments, there's always a comments to the end. This video is part of a number of similar presentations exploring the role of the in vivo environment has on the behavior of spermatozoa and the interaction with the oviductal space and whether this is important for IVF or ICSI. The information in this and other videos tells that there is a critical alignment of sperm behavior and competency, but does this make any difference? Does ICSI just override any other vivo activity? It doesn't make any difference. And I can assure you there'll be a lot of people with IVF who are not sperm-orientated embryologists who would dismiss this. They're more interested in looking at euploidy status or genetic activity of the embryo. But I suspect, my gut feeling, is having done a lot of videos now, more than I've ever done in my whole working life, is that my gut feeling is that the quality and the maturation process of the fertilizing spermatozoon will impact on the critical first few hours of the zygote's life, and this will influence embryo development days later. I'm going to stop there. I'm trying to make this video as short as possible. My name's James Stanger. I had more than 50 years experience in IVF. I'm not a medical person, and this information is not medical advice, but it may help you knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding it. And maybe I might just set aside here, if you are a IVF client looking at this video rather than IVF staff, it would be quite reasonable for you to go back to your clinic and ask the scientists how they process their sperm and how do they select the best sperm, and is this sperm any different to what's happening in their own fallopian tubes. And I suspect most scientists will not know anything about it. If you like what I'm doing, press subscribe or press like and leave a comment and tell other people about it. I just need to recognize that I already have an online EQA program. This is paying for this videos, fertile.com, and this involved in training and education, quality assurance in IVF and andrology. I'd like to thank you for your time if you got this far. I know IVF is a personal journey that involves many concepts of many actions of new techniques and people and ideas, and it helps to understand all aspects of this journey. I hope it's of value. And at this point in time, I will say thank you for your time and goodbye.